Look, as a mom, as a woman, I know how unique this opportunity is and how everyone's path to parenthood is really different. What are the needs you are serving out there that aren't being met by other options?
I think, well, thank you so much for having us here. And I think that's exactly it, Emily. Each path to parenthood is so unique. And even one pregnancy is really different than another pregnancy. Starting the family building journey with IVF is just a very different experience. And so, what Maven does is we have a virtual care platform really focused on filling in a lot of the gaps in care along the way, whether that's, specialty support around nutrition, mental health, lactation support after having a baby, return to work support, adoption support, so that as somebody is navigating the in-person system, they have those core experiences, but Maven's really helped in the background, not only helping them navigate it, but then filling in a lot of the gaps along the way with the virtual care.
So you've got high-profile investors, Reese Witherspoon, Oprah Winfrey, Ann Wojcicki, Mindy Kaling, but dozens of investors walked away from this in the early stages. Deena, what did you see that other investors didn't?
Thanks, Emily. Women's health has been underinvested in and frankly under-innovated in for so long. And it is a major category in healthcare. Not only do women represent 50% of the population, but 80% of the dollars that are spent in healthcare. It is a critical wedge into changing outcomes in this country. And it also represents one of the biggest cost centers for employers. Employers who now are seeing attrition in the workforce, who are having employees experiencing mental health crises as they deal with working from home and taking care of their children and taking care of their parents. And it's time that women's health is now at the forefront of where it should be, at the center of healthcare. Maven Clinic emerged as the clear category winner in a space that is finally getting the attention that it deserves.
So, Kate, what are you seeing that works best on the platform? Where are users engaging most? Where do you see, the most demand, if you will?
Well, I think what has been amazing to watch over the past 18 months with COVID, as so much of healthcare has shifted to virtual and telemedicine, is we've really seen just in general an embrace of telemedicine as one of the core ways to fill in these gaps. We've seen our network utilization rise by 50%. And then in areas like mental health, which mental health is just so core to the family building journey, we've seen a 300% spike. I think also as so many employers and health plans are stepping up right now to figure out, in this time, what are other benefits that we can give, because this has been such an underserved area for so long. Really, we're also seeing, a massively increased utilization in our care advocates as they're helping be those navigators to help our patients find the best fertility clinics, the best OBs, the best pediatricians, and even the best child care vendors.
Now, part of the challenge is getting insurance companies to cover these kinds of benefits. And I noticed that, most insurance companies, you can't use insurance generally, as I understand it, through the platform. Deena, how do you change that? And do you see that as a deterrent to future growth? Because that's going to be one of the first hurdle for people looking for help.
Absolutely. One of the values that Kate and I and the early investors share is around health equity and health justice. And this is particularly important in women's health, where our country is experiencing a Black maternal health crisis, where morbidity and outcomes are unfortunately disproportionately weighted towards underrepresented communities. So whether it's employers or payers, it is critical that we have access to care in addition to quality care. And that is something that Maven has been working towards, and there will be some exciting news to come there, in addition to their incredibly fast-growing and robust employer business.
So, Kate, tell us a little bit more about that journey. I mean, getting the rest of the world essentially on board here, getting these benefits covered.
Yeah, I think one of the biggest reasons to your question around health plans, one of the biggest reasons we were rejected early on is because a lot of the health plans weren't yet ready to kind of embrace innovation in this space. They didn't have a centralized women's health strategy. I think, as we've kind of grown, as a lot of the data on our platform has really proven out that there's tons of engagement and that there's such a need for, a lot better health equity. One of the big things that we do on our telemedicine platform is that we cultural care match so that patients can talk to providers who look like them, who have their same race, gender, ethnicity, and we really give options around that to build trust. That's an area where I think virtual care can really step up and support. And so I think what's happening, I'm actually at a healthcare conference right now. I think what's happening is that a lot of people are waking up to the promise of how digital health can come in and solve some of these gaps. And some of the biggest players in healthcare, the health plans, the health systems, they really are looking more to partners versus just building or buying everything themselves.
And, Kate, there are so many women entrepreneurs out there who are struggling to raise funding, who, believe they have a great idea, can't get investors to listen. As I understand it, something like 40 VCs walked away from Maven in those early days. What was that like for you? And what advice do you have for other women, other entrepreneurs out there who might be going through the same thing?
It's I think it could have even been more than 40. That was like one round. But basically, entrepreneurship, so much of it is about persistence. And if you're seeing all of the signals, and for us, it was, patients that we didn't have many, but they were really kind of loving what we were doing. We were starting to kind of get the signals in the market from the clients themselves, and employers often are, some of the biggest innovators in healthcare, and they'll adopt new solutions first. And so we were seeing some of that early adoption. And so, it was kind of, and the numbers, of course, are all on our side. This is the largest industry in the United States. That, it was kind of like, all right, well, we're not going to quit. And so I think for the advice for founders is if you have all of that pattern matching and that signals that this can be something big, and you believe in your gut that you're onto something here and the world needs it, keep going. There's, and it's just a game of, having a lot of supportive friends and family along the way, and an awesome team who can kind of, help you through the rejections and keep building, something really important for the future. A lot of the best businesses have had so many rejections. And so there's so many stories to kind of lean on to get through some of those hard times.